All right, good evening, everybody. I think we're about to start. The Prime Minister is on his way. I think I wanted a little bit of social distancing, but this is as good as it gets for us, right? All right, so in preparation to start, can I ask everybody, this just the usual thing. Good evening, everybody. If the phones would be on silent, that would be good. And then we'll begin shortly. We'll do a countdown for the media and give them a 30-second countdown. Yes. Okay. All right, good afternoon, good evening, ladies and gentlemen. Thank you so much for being here at the Office of the Prime Minister. For those who are joining us live on stream, especially those in the media, we'll give you 30 seconds to begin your live broadcasts and stream, and then we'll begin. Good evening, everyone, and welcome to the OPM Media Center here at the Office of the Prime Minister in Kingston, Jamaica. Thank you so much for joining us. Prime Minister, the Most Honorable Andrew Holness, presided over the meeting of the Cabinet and in commitment to his pronouncements that he would update the nation and the media on happenings concerning the deliberations of Cabinet concerning the COVID-19 pandemic and its effects on Jamaica. The Prime Minister will do so momentarily. We're joined this evening by several members of Cabinet, to include the Minister of Finance, the Minister of National Security, the Minister of Tourism, along with the Minister of Local Government, of course the Minister of Health, the Permanent Secretary here at the Office of the Prime Minister, Mrs. Audrey Sewell, along with the Permanent Secretary at the Ministry of Health, the Minister, of course, of Education, Youth and Information, along with some senior government officials, are here to ensure that you get the very latest in terms of information and provide some resource for the Prime Minister. Ladies and gentlemen, the Prime Minister of Jamaica, the Most Honorable Andrew Holness.
Good evening. Good evening, everyone. We have always known, and indeed we have said, that as we progress through the epidemic, that there would be an increase in numbers and even a spike. We have done fairly well. We have lasted about 33 days on a linear scale. We have put in place measures which, by and large, the country has followed. I think we could say that the majority of Jamaicans were faithful in abiding by the tighter curfew hours imposed during the Easter period. My discussions with the Commissioner of Police would suggest that, in general, there was a great level of compliance. But as we have always stated, it only takes just one act of not faithfully following the measures to cause an outbreak. We are at that point where we are seeing an increase in the numbers. And I'm going to invite the Minister of Health to give you the details as to where we are now in terms of the numbers. Minister Tufton.
Thank you very much, Prime Minister. Colleagues, ladies and gentlemen, So Jamaica can now confirm that we have 105 cases of COVID-19. This follows 32 new additions over the last 24 hours. The new cases comprise of 5 males and 27 females who range in ages from 19 to 70 years old. The cases are from St. Catherine, Kingston, and St. Andrew. They bring to 34 the number of cases under investigation. Of the remaining 71 confirmed cases, 31 are imported, 34 are contacts of a confirmed case, and 6 are local transmission. The vast majority of the 32 additions, indeed 31 of the 32, are linked to a call center located in the Portmore area, Olorica Intervention. This facility has a staff complement based on the staff registry of some 787 workers. We have so far in our intervention, 258 individuals have been interviewed and sampled. 65 of those tests have come back, and of that number, 33 samples have come back positive. 2 were announced a few days ago, so 31 since today. A senior team from the ministry visited the entity on the weekend, in fact, during the course of the holiday weekend, and the entity has since closed. Arrangements are now being made for the isolation of the newly confirmed cases. The ministry is also working diligently to identify each of their contacts for testing, while investigations continue to identify other positive exposed persons. The St. Catherine Health Team comprises of approximately 237 members of staff, which includes public health nurses, public health inspectors, and community health aides, and they are in fact driving that charge in the parish of St. Catherine. A lot of activity taking place now in St. Catherine as we speak, and will continue over the days to come. In terms of recovery, quarantine, and isolation, currently 21 persons have recovered from COVID-19, 20 persons are in quarantine, and 65 persons are in isolation. We have now tested 1,290 samples, and of that, of course, we have had 105 confirmed positives, 1,185 negatives. Over the last day, we announced the mobilization of our mobile testing unit as part of the expanded testing efforts. And we have started in Clarendon, in the Corn Peace area, and this will continue over the days to come. We have 5 such units, and those units are going to be deployed in the respective regional authorities to expand the collection of samples for testing. The actions to contain the spread of COVID-19 and to ensure the best possible health outcomes for infected persons continue to require our best efforts and all our efforts. The challenges in St. Catherine, we think, will continue for some time to come, and we intend to work, this is the public health infrastructure, to mobilize the all-of-society approach in order to contain what is an unfortunate situation, but one that we have to confront and deal with. Thank you.
Thank you, Minister. I can only continue to stress the importance of every single Jamaican taking personal responsibility for maintaining the recommended health protocols, the orders given by the government under the Disaster Risk Management Act, and just general common sense in protecting your personal health, the health of your family, the health of your community, and indeed the nation. Aside from the individual responsibility, there is a corporate responsibility and a government responsibility, where persons who are entrusted with resources and management over others are required to exercise a higher level of diligence The government certainly has exercised a very high level of diligence, and we continue to work very hard in the country's interest to ensure that the outbreak is contained and controlled. But as I've said earlier, it was always expected that there would be a spike. And the announcement now of 32 additional cases, Minister, 32 additional cases, when in the past the highest number we have had in any one testing would have been 6. That tells you that you are now entering into a new phase. And this is not meant to scare anyone, but indeed maybe it is that we should be scared. Maybe that is the only way that behavior is going to change. But I don't want panic. What I want is concern. What I want is for people to take responsibility. What I want is for people to listen to what the government is saying and follow the orders, the recommendations, and follow them faithfully. As I had indicated before, the government will put in place actions that are appropriate to the circumstances that we face. We therefore, having discussed the matters at length today at Cabinet, and after considering the advice of the public health team and carefully considering all the dimensions of the problem we face, the government at this point is announcing that there will be a lockdown for the parish of St. Catherine, starting at 5 a.m. Wednesday morning April 15th, 2020, through to 5 a.m. Wednesday, April the 22nd, 2020. That is a lockdown starting 5 a.m. tomorrow for the next 7 days, ending 5 a.m. on the 22nd of April 2020. What is the objective of the lockdown? The objective of the lockdown is to slow as much as possible the spread of the virus. The minister gave you some numbers as to the number of persons tested, and with 33 persons confirmed, you can use your own imagination to figure out how many persons have been contacted, the areas that people would have traveled to, and the potential spread that can come from that. So technically, you could be looking at as many as 1,000 persons contacted in close proximity. The effect of that is very great, and therefore the measure that we have to put in place is one that would seek to contain and slow the spread of the virus in a particular geographic area. The reason why we are looking at putting in the lockdown now on St. Catherine is that we have done a GIS, that is a Geographical Information Systems, mapping of the addresses of the affected persons. And we are seeing where the addresses cluster. The addresses of the 300 plus that we have already mapped have clustered mainly in St. Catherine and parts of Kingston and St. Andrew. For Kingston and St. Andrew, we're doing further work. We have a further 300 plus addresses to map. And once we can fully identify the clusters, then other actions will be taken. So for St. Catherine, we know already that there is a massive cluster and that the spread there is particularly probable just by virtue of the existence of the call center in Portmore. People having traveled to the call center would have used public transportation, would have congregated in public areas, so there is a concentration there. So we have to start, and I want to be clear on that to the public. This measure is a start. And we're starting in St. Catherine, depending on what the other mapping of the addresses show and how the cases progress from here, then we will implement broader, tighter measures. If things go well in the sense that there is no further spread and we have contained it, then there is no need. But the government has been very responsive, very agile. As we test, as we look, as we see the data, we act accordingly. So I'm putting Jamaicans on notice that we have entered into a new phase, and as we have said before, when we are in this phase, the appropriate actions will be taken. So it shouldn't be a surprise that we are taking this action. What does a lockdown mean? Well, the first rule of the lockdown is that if you are ill with any form of flu-like illness with symptoms or any respiratory illness with symptoms, stay home. Some people don't understand that. Tana your yard. I'm sure everybody understands that. More than that, isolate yourself. Stay in a room in your house. Stay away from people as much as you can. If you are ill with any form of respiratory illness with symptoms or influenza-like symptoms, flu-like symptoms, that means you're coughing, sneezing, having a fever, stay home. You are not required to go to work. No matter how essential you are, stay home. The orders that will be in place will take the obligation off you to come to work. If you are ill, stay home. We will place an obligation on the employer that if you turn up to work, they have a duty to report you and send you home. And these obligations and duties come with a penalty. And I will be discussing penalties later on. So that is the headline. Number one, if you are ill, stay home. If you are 65 or older, stay home. Stay home. Even in a complete lockdown, there will be need for the essentials of life. Movement is only permitted for the essentials of life. Now, some people might believe that a bar is essential for life. I've seen a video circulating where there is an appeal. I'm certain that in this time of great trial for the Jamaican people, everyone understands that the essentials of life would mean, first of all, food and medicine. So you are only permitted to move to replenish your cupboard, or if you need to replenish your prescription. There is no other reason to be on the road. The AG is reminding me of another one. Well, I would put that under medicine, if you have to go and see the doctor. And then it would have to be an emergency. The police force has been so advised. How do we enforce this? Really, this should not be a matter of enforcement. Really, we should be relying on the reasonable man to take care of their own interests. But that is not always the case. All persons being on the road or in a public space, that means they are not in their private residence, must have identification. The identification should be either a government-issued ID, which would be your passport, or the voter's ID or the driver's license. We would also consider IDs issued by various ministries, departments, and agencies, IDs, as long as they have a photograph which is visible. The police will exercise discretion in other areas. If you have, for example, an ID issued by a registered university, tertiary institution, or a school, the police will use their discretion as long as they can see your face matching what is on the photo ID. Why do we need you to have ID? For persons who are 65 years and older during the period of the lockdown, you will be allowed to pursue the essentials of life between 8 a.m. and 10 a.m. Well, let me just back up a little bit so that we're clear. The pursuance of the essentials of life will not be done every day within the 7-day lockdown. You will be allowed 2 days in which you are allowed movement to pursue the essentials of life. These are the days that we expect our citizens to be able to restock their cupboards, refill their prescription. For medical emergencies, you will be allowed as they arise. And I think everybody should understand that point. As if you have a medical emergency, it is an emergency. You go out on the road, carry your ID, explain to the officer if you are stopped. An understanding policeman using his discretion would probably be escorting you, helping you to get to the doctor, if that is possible. The 2 days for restocking would be Wednesdays and Saturdays. And I use the days in plural, which signals that though we are going for 7 days, it is likely that it could go for 14. So the plan that we have is that within the 7-day period, you will have 2 days for your restocking. So you would have Wednesday the 15th, which is tomorrow. You will be allowed to get your stock, which is only fair, seeing that it is short notice. And Saturday the 18th. Again, we think that that is fair. So, if you are 65 years or older, if you are a pregnant woman, well, I should just say if you are pregnant, and if you are otherwise abled, and I hope everybody understands what I mean, if you are a person with disabilities, then you will be allowed between the hours of 8 a.m. and 10 a.m. to pursue the essentials of life. We expect you to pursue only the essentials. So I wouldn't advise that you go too far, that you go to the nearest point to get your stocks refilled and return home immediately. There is no time for window shopping, to go and meet your friend, no time for that. Just go pick up what you have to pick up, return home. If you are elderly and you are not able to go by yourself, the police and military have been advised that if an elderly person is being accompanied, that's fine. That should be encouraged, actually, as long as you are maintaining the necessary hygiene protocols, because you don't want to endanger the older population. If you are well, let me rephrase what I was about to say. So if you are not in that category of the 65 years and older, between the period of 10 a.m. to 1:30 p.m. on Wednesday the 15th and Saturday the 18th, and your surname begins with A to M, you can go out onto the street, preferably one person per household. We don't want everybody onto the street, one person per household, with ID, to pursue the essentials of life. Again, the same advice. Go to the closest point, get the things you need, and return home as quickly as possible. If your surname is between N and Z, or Z, whichever one you prefer, between 1:30 p.m. and 5 p.m., you will be expected and allowed on Wednesday the 15th and Saturday the 18th to pursue the essentials of life. And the essentials of life, again, is to go to the supermarket or the corner shop or the pharmacy or the gas station and return home. For clarity, let me repeat, therefore, the parish of St. Catherine will be under a lockdown from 5 a.m., that's tomorrow morning, Wednesday, April 15th, 2020, through to 5 a.m., Wednesday, April 22nd. During the lockdown, everyone is expected to stay in their premises. If you are ill, whether you are an essential service member or not, if you are exhibiting symptoms from flu or respiratory illness, stay at home. If you're coughing, sneezing, sniffling, cold, fever, stay at home. Tan a your yard. More than that, isolate yourself. You are allowed to pursue the essentials of life, but this has to be done in an orderly way to limit movement during this period of time. 2 days are allowed for you to pursue the essentials of life. Wednesday the 15th and Saturday the 18th. You will pursue the essentials of life in the following way. If you are 65 years and over, if you are pregnant, or you are a person with disabilities, you can go to your pharmacy, to your supermarket, to your corner shop, purchase the items that you need, and return home. And that is between the hours of 8 a.m. to 10 a.m. If your surname begins with A through to M, and you are below 65 years of age, then between 10 a.m. and 1:30 p.m., you can pursue the essentials of life. If your surname begins between N and Z, between 1:30 p.m. and 5 p.m., you can pursue the essentials of life. Everyone who is going to venture on the road or into a public space must take with them some form of identification. That identification must bear a picture, It must be either a government-issued ID, which could be your passport or your driver's license or the electoral ID, the national electoral ID, or an ID issued by the any ministry of government, department, or agency of government. The police will use their discretion as it relates to other forms of identification, for example, IDs issued by registered universities or schools or a recognizable institution of public note. In this regard, whenever you are in the public within St. Catherine during the period of the lockdown, you must wear a mask. I'm putting it in this way. The requirement, when it is probably written in the Gazette, will be that you must have your nose and mouth covered. It could be a mask, it could be a scarf, but whatever it is. And I'm seeing some very innovative designs taking shape now, and I'm seeing them right inside this room. You must wear a mask. You must cover your nose and mouth in public. All the social distancing rules apply, and the Gazette, when published, will specify that there is now a duty. There always was, but we will be much clearer in it. A duty on those businesses that are allowed to remain open. There will be a duty on them to make prescriptions, define space for people to stand and form lines in order to access service, which means that there will be defined spaces 3 feet or more apart that each person can occupy to get service. This is all new to Jamaica. And I know it is not going to be easy for people to comply. Some people will see it as a tremendous imposition, a tremendous burden. But I just want you to stop for a moment and reflect on what has happened. We have been going quite nicely all along. And just one instance, and you see the numbers balloon. People haven't been taking it seriously. This is a dreadful disease. It has taken many lives. And Jamaica is particularly risky in terms of our population health profile, with many NCDs which weaken our immune system and exposes us. Obesity, diabetes, heart conditions, respiratory conditions, hypertension, all of those are prevalent in our society. And so the uncontrolled spread of this disease in addition to having to treat all of those conditions, would place our health system under severe stress. We don't want to have to make the decision, as other countries have had to make, who lives and who dies, who gets on a ventilator and who doesn't, who gets a bed and who doesn't. But if our citizens don't act responsibly, then that is the burden that you would thrust upon the government to determine your life, when you can literally determine the outcome of your life by being responsible. So we have had to take this drastic action. Today I had a virtual meeting with the BPO Association. Now let me say from the outset that not all operators of BPOs are members of the association. They all fall under regulatory authority, the Jamaica Special Economic Zone Authority. But the group that I was able to meet with at short notice, having just gotten this information, was the BPO Association. Generally, by and large, from the reports that we have received, most of their members have been following the recommended protocols. They have established protocols that are higher than the recommended protocols. In fact, I was pleased to learn that they have moved 26% of their employment to work from home arrangements. They have, the BPO sector employs close to 40,000 persons, and they have moved over 10,000 persons into work from home arrangements. They are looking at other mechanisms. But it is clear that there are some operators who were not following protocols, who were not faithful in observing protocols. What we will have to do as a government, because this is now a matter of national importance, it is a matter of ensuring compliance. I have asked the Commissioner of Police to thoroughly investigate, along with the Health Department, the circumstances under which this outbreak took place and to pursue charges under the Disaster Risk Management Act. We cannot take this thing lightly, and consequences must fall where we can establish culpability. So I'll leave it there for now, and I'll ask you want to make the... Right, the Attorney General is reminding me that the general curfew, which we announced, that continues. And remember, because of the good behavior of the majority, and we see where persons are complying, and we want to encourage economic activity in a managed and controlled way to get that balance between lives and livelihood. We increased the functioning time between the curfew hours. So now the curfew hours generally for the entire island is now from 9 p.m. to 5 a.m. However, if things change, if results come back in a way that suggests that the outbreak is moving more rapidly and more intensively than we had expected, then we will have to make other arrangements. But for now, these hours stand. Just to be clear as well, markets will be closed in the parish of St. Catherine. We will be looking at all BPO operations. We have asked the Ministry of Health. I know you have done your inspections already, but I think we are going to do some more intensive inspections, and we're going to re-examine the protocols that are in place to see if we can't put in even tighter protocols. But generally, within the parish of St. Catherine, to be clear, almost all commercial activities will come to a halt for 7 days. There should be no unnecessary movement in that parish for 7 days. Well, except, of course, those that I have noted, for the essentials, to pursue the essentials of life. And those will be noted and quite clearly defined when we publish the Gazette. But corner shops, supermarkets, pharmacies, those will remain. Hospitals, health centers, those will remain open. The essential services, those members of the essential services will be allowed to move with the display of ID. They will be allowed to move out of the lockdown zone to go to their work. However, everyone should note that all entry and exit points out of the parish are now checkpoints. And the police are now equipped with laser, what's the appropriate term? Temperature meters, temperature check meters. And they will be able to take your temperature. And if your temperature is above the accepted levels, then you will not be allowed to leave the checkpoint. And indeed, you will be, the Ministry of Health will be alerted, and they will do the necessary protocols from there to ensure that you are not someone who is positive with the coronavirus. So you're only subject to move, or you're only allowed to move, if you don't have symptoms. Let me just say that again. So you might be a policeman, a fireman, a nurse, but if you are ill with symptoms that are flu-like or respiratory illness symptoms, you must stay home. That is the critical thing at this moment. If you are ill, stay away from the healthy population. If you are in the vulnerable group, as far as possible, stay away from the general population, because there may be persons in the general population who could get you ill. And the healthy population, stay in as much as possible, limit your movement, and that will limit the spread of the disease. All right, so I'll leave it there for now. There are many matters that people have asked questions about, including what the government can do about rent and landlords. I have some persons here who would be better able to answer your questions. The Minister of Finance is here. He wants to give an update on the CARE program and how well that has been going. And I think I will call upon the Minister of Finance now to give his update.
Thank you, Prime Minister. The government's CARE program launched on Thursday, the 9th of April, and by midnight, at the end of the 9th of April, we had over 120,000 applications. I'm just going to use round numbers for this summary. And by the end of Monday, or by Monday afternoon, we had approximately 333,000 applications in total. Now, you will recall that the CARE program has a number of components, and one of the components is the Compassionate Grant program, that is geared towards those who are unemployed, those who are informally employed, elderly, and students over 18. And for the Compassionate Grant Program, by yesterday afternoon, we would have had about approximately 277,000 applications. For the Set Cash Program, which is a program designed to cater to those who would have lost their employment after the 10th of March, we had approximately just under 47,000 applications as at the end of yesterday. And for the General Grants Program, which is geared towards various occupational groups that are targeted by the program, we had a total of about 8,000 applications up until yesterday afternoon. Now, an application is successfully made once the TRN that is provided matches with the date of birth provided and the name provided, and all three of those variables are consistent with what Tax Administration Jamaica has on its database. Now, it's very important for that verification to take place. The funds that will be used to make these grant payments are taxpayer funds. They're funds that belong ultimately to you, the people. And it is very important that before someone can be eligible, we have to ensure that that TRN is a valid TRN. Now, there are persons, so when we say that we have had 333,000 applications up until yesterday afternoon, what we mean is that we have had 333,000 persons apply where their TRN matches their date of birth and matches their name. There are a minority of cases in relation to 333,000 where persons have tried to enter and to apply, and the system doesn't allow them to proceed because the TRN that they have entered does not match the name and the date of birth that Tax Administration Jamaica has in their system. The only way around that is to make a call to Tax Administration Jamaica and try to have that rectified. The CARE program has to work with the established database that Tax Administration Jamaica has to ensure that there is an accountable and transparent use of taxpayer funds. With respect to the compassionate program, compassionate grant, once a transaction or once an application has been made, a confirmation number is issued. Indeed, a confirmation number is issued for all of the components of the CARE program, and that is sent by text to the mobile number that is provided or by email to the email address that is provided. That reference number or confirmation number is a very important number and should be retained by applicants because it can be used to track the progress of applications through the website or for claiming the benefit if the benefit is to be claimed at a remittance outlet. For the compassionate grant, there are two means of collection. The first is by a direct transfer to a bank account that is specified or given by the applicant in the process of making the application. Now, an application will only go through if the name of the applicant is the same as the name on that bank account. And indeed, we have had close to 200,000 applicants under the compassionate grant, or actually a little, or just under, up until yesterday, who have submitted bank accounts for which there is a match between the name on the account and the name of the applicant. There are some who are not in possession of bank accounts, and so we've made the facility for payment to be directed towards a remittance company of their choice. Payment will, once eligibility is established and verification is completed, payment will be remitted to the remittance company, and to collect that payment, the applicant will have to provide to the remittance company a photo identification in the name of the applicant. They will need to be able to recall their TRN, and they will also have to provide the reference number that is sent electronically on confirmation of receipt of their application. The verification that's required under the compassionate grant is a check to verify that the applicant is not included in any of the employment databases that Taxation Jamaica has access to. With respect to the set cash grant, the set cash grant is for any person who lost their employment after the 10th of March, provided that that can be verified. And the person could have worked in any one of a number of industries. As I mentioned earlier, we have seen 47,000 approximately applications as at yesterday afternoon. And those applications come from a range of industries, the vast majority from the tourism sector. St. James, the tourist capital of Jamaica, leading the way with over 10,000 applications, followed by, not in any particular order, but the parishes of St. Anne, I believe, and then Westmoreland, and then Trelawney. But their applications for the set cash grant, which fall outside of the tourism sector, we've seen applications from persons who have been laid off in the restaurant business and in other sectors as well. The verification process will require the employers in those sectors to upload electronically a P45 form that verifies the persons who have been laid off. And that is very, very important because, again, as we will be remitting taxpayers' funds, it's important for transparency and for accountability for the CARE program to have independent proof that the applicant indeed was employed and indeed has been laid off after the 10th of March. And that will come from the employer providing that verification by way of uploading the P45 form. We will be in touch with the umbrella groups such as the Jamaica Hotel and Tourist Association, the Private Sector Organization of Jamaica, the Jamaica Manufacturers and Exporters Association, the Jamaica Chamber of Commerce, and other business groups, in addition to the major unions who represent workers, to advocate and ensure that employers comply and upload that P45 form so that their former employees or the employees who they have laid off can be verified, and by being verified, they can be in receipt of their set cash grant. With respect to the general grants, the application is accepted once the TRN and the date of birth and the name are consistent with what Taxation Jamaica or Tax Administration Jamaica has on its database, and payment would be facilitated or made once the applicant's TRN is among the TRNs provided by the particular regulatory or registration authority that evidences that that person actually is in the occupation that they have applied in. So, for example, those who operate in the Juta contract carriage business or would need to be registered with the Tourism Product Development Company, and those registration details will provide the data from which verification takes place. So these are independent processes. The CARE application is an independent process, and then we'll have an independent database provided by Tourism Product Development Company, and there'll be a check between the TRNs in the application and the TRNs listed in the registrations, and those for which there's a match, that verification will have been confirmed and a recommendation for payment made. The same is true of taxi PPV licensees. The Transport Authority will be providing the database against which verification will be made, and that will precede recommendations for payment. The same is true for the occupational groups for which parish councils are the licensees. The parish council will be providing the list of TRNs for persons who occupy the occupations of barbers and hairdressers and market vendors and many other occupation groups that are specified on the website and in the brochure. And once those lists are provided, again, there will be a cross-reference between the applications for the general grant and the TRN that appears on those lists provided by the parish council. And once there is a match, again, then the recommendation for payment will be made. The recommendations for payment are made by the care system after this verification process, and they're made to the Ministry of Finance, who then would instruct the Accountant General to remit payment either to the bank account specified or the account at the credit union or at the building society, or to make a transfer, in the case of the compassionate grant, to the remittance company. Now, this process is one that will abide by the greatest of transparency, and as a result, I have requested of the Auditor General that she reviews the application and disbursement processes, and I fully expect on a concurrent and simultaneous basis, and concurrent means that review, we don't want to wait until the program is ended for such a review to take place, but for the review to take place while the program is ongoing. The delivery mechanisms for such an intervention of this kind did not exist 3 weeks ago and had to be built from scratch in record time in order to make what will be the broadest and largest fiscal intervention of this kind, certainly in Jamaica's history. And so we expect that a draft of that review will be available to us, prior to the first payments being made, or at least that is what we're working towards with the Office of the Auditor General, and we are grateful and thankful to that office for responding in the way that they are, and for providing the level of assurance that is necessary for a process such as this. That, Prime Minister, that concludes the summary of the CARE program as at yesterday, Monday, the 13th of April. Needless to say, the applications are continuing, and a further update will be provided at a later date.
Thank you, Minister. Just for further clarity, we've been monitoring questions on social media. People have been sending us notes. The island-wide curfew, which is from 9 p.m. to 5 a.m., still applies today to the parish of St. Catherine. So persons should by now be making their way home in St. Catherine to meet the 9 p.m. curfew, and that curfew will come to an end at 5 a.m. tomorrow. But at that point in time, you will transition into a new arrangement, which is a lockdown arrangement. And I want everybody to be clear on that. There are some people who are saying, so if I have my work ID, does that mean I can show my ID and come to work? No. You have to stop moving. You have to stay in your premises. And if you are ill with flu-like symptoms or respiratory symptoms, stay indoors, stay in your house, and isolate yourself from the rest of your household. In fact, that is an order under the Disaster Risk Management Act for every single Jamaican. If you are ill with any flu-like symptoms, any respiratory symptoms, stay inside your house and isolate yourself from the rest of your household. I think we can now take some questions. I have with me persons here from the Rent Assessment Advisory Board. I know the media has been asking many questions. They are prepared to answer questions that may be asked about rent. Generally, we have looked at the issue. Government really doesn't have entry into the conversation because rent is usually a contractual issue, and once it is within the ambit of the law that is established, the government could not, in a casual way, vary what is already contractually arranged. But we are still willing to take questions. So, Naomi, if there are questions, we're ready to answer.
There are many, sir. So let's start off with our colleagues on Zoom in the media. We have hands up already. We ask, of course, those on the Zoom that you ensure that your background is sterile, and certainly once we identify you, you just ensure that your microphone is on. Our first person to ask a question, Ms. Dion Jackson-Miller from the RJR Communication Group.
Thank you so much, Naomi. Question number one, how many of the 33 call center workers were actually symptomatic, and how many people are now on ventilators? Two, I'm trying to understand how the St. Catherine lockdown works in the context of the fact that people travel through St. Catherine to get to other parishes, and also against the background that we have the other parishes in Jamaica. Might people not even now be rushing home to pack a suitcase and move out elsewhere? And three, in terms of the call centers, wasn't this inevitable given the fact that workers have been complaining for weeks that these distancing protocols were not being observed, and the various recommendations that we heard were to be implemented in the call centers, the workers have been saying for weeks were not happening?
As it relates to traffic through the parish, the main roads that traverse the parish, those will be policed in a particular way. So, for example, if you are on the east-west highway coming through, you should be fine. It is when you start to move from the internal roads to get onto those highways that you will be checked. So the police will be appropriately positioned to check people getting onto those roads that would lead you into Kingston. We spent a lot of time looking at that logistics, and I'm certain that the security forces have made the arrangements such as not to unduly prohibit traffic flowing from other parishes into Kingston and St. Andrew or elsewhere through St. Catherine. Right. In terms of the questions about the actual numbers, whether it is persons on ventilators, and I believe the other question was how many persons were actually symptomatic at the call center. Let me ask the CMO as well to address the issue of complaints that were made to about BPOs not following the protocols.
The collection of the samples would have taken place, and the interviews that were done would have taken place over days. So for the first day that we went out, we had 5 symptomatic persons, and those persons were all isolated. On the second day, we had no symptomatic persons. On the third day, we had 25 symptomatic persons. In all, we have about 30 symptomatic persons of the 258 persons that were interviewed up to last night. Not all of those would have been in the batch of results, because some of those in the last batch of 25, we would get the results today. In terms of persons on ventilators, we still have only one person at this present time who's on a ventilator.
I think, Simo, before you go, the question about complaints coming from employees about the protocols not being observed at the BPOs. You could say what was the outcome of the health inspections that were done.
I would not be able to give the details of those health inspections. I understand that those were done within parishes, so that is something that we can look at and provide a report on. However, what we would be looking at now is to put in even more measures and to offer more advice in terms of how those organizations that have large persons at work are operated on. So we would have to provide a report at a later date as to the investigations that were previously done, and then to update on the new recommendations that we would be putting forward with regards to the operation of facilities that have large numbers of workers.
And to enhance what the CMO has just said, as I said before, the business process outsourcing industry has an association, but it is also regulated by an agency of government. That agency of government is the Jamaica Special Economic Zone Authority, which is under the Ministry of Economic Growth and Job Creation, a ministry for which I have direct responsibility. So I have been interfacing with the BPO Industry Association of Jamaica quite regularly. I am aware of the protocols that they have established, and I have seen where many of the members have been following the protocols strictly. But we are also aware, and we have intervened when it was brought to our attention, that there were some members and some persons who are in the BPO sector who were not necessarily following the protocols faithfully.
Thank you, Mr. Prime Minister. Let's go to Brittany Clark of Nationwide News Network.
Hello, good evening. All right, so I have 3 questions. Firstly, the United States has decided to send a number of deportees to Jamaica despite the pandemic. If or when we accept them, do we have the resources or the facility to quarantine these deportees, who we now understand are numbers upwards of 40? And how much more is it going to cost the government? My second question, the testing capacity we were last informed was at 150 per day. Have we improved on this capacity, and how many persons have we tested per day on average since the closure of the borders? And my third question, final question.
I thought you said 2 questions.
Oh, my 3 questions. All right, so given the spike in the numbers with quite a few linked to the BPO sector, are there plans or considerations being made to shut down the entire BPO sector? And does the government regret not acting sooner? Thank you.
Well, I could take that question, and then I could ask Minister Tufton to take the question regarding the testing, and then I'll ask the Minister of National Security to join me to deal with the question of the returning, returning deportees. As I said before, we have always been supervising and ensuring that the industry, the business process outsourcing industry, had strong protocols. We made provisions for them to be able to function during a period of restrictions, and we put in place measures, and they were inspected. I happen to know, having asked questions, that the majority of the BPOs were spending resources to ensure that they had the protocols in place. But yes, there were, and I repeat that, there are some BPOs who were not following the guidelines. And in fact, one was brought to my attention, and I intervened in that, and then, of course, checked to see that the intervention made a difference and that they put in place measures. Generally, as reported from the industry and our supervision, most BPO operations have been putting in place measures. And in fact, I want to repeat that they have moved almost 10,000 of their workers off the working within the BPO industry. They are not now working from office. They have now moved to be working from home. And that is a massive shift for the industry. Could we have acted earlier? I mean, what we will be doing in investigating is looking at whether or not there was any breakdown in our own procedures, whilst we also investigate to see what breakdowns there were in the particular company where the outbreak occurred. So yes, we will be looking to see whether or not we could have acted any earlier than we did. The point of fact is that as soon as a case came to our attention, the entire machinery of the Ministry of Health was mobilized. And you can see that between the first case being brought to our attention, which I believe that would have been Friday, Good Friday, to now that we have mobilized to be testing, how many tests we have done for the BPO minister? For that facility. So there are over 300 workers there. 700 and plus workers. 258 workers. So we have mobilized. And in fact, you will see that we have acted today very swiftly.
Thank you, Prime Minister. So in terms of testing, we are now able to do, on average, about 90 tests per day. We are over putting in a second facility that is going to be at the Public Health Lab. The current facility at the National Influenza Center is located at the University Hospital of the West Indies. We're installing a second facility at the Public Health Lab, which is located at the blood bank. And when that is installed and running, which will be by the end of this week, Friday to be exact, we should be in a position to do some 350 tests per day. There are some additional discussions taking place, which we will elaborate on as it relates to another approach to testing. But to date, we have the capacity for testing, which is why we have deployed the mobile units, which will be able to collect more samples. That capacity has not been exceeded, and we are doubling that capacity. And over the last 4 weeks, we have literally doubled the testing each week with the intention to continue on that going forward.
Thank you. We had a request for the normal return of a number of inmates from the United States government end of last month, and discussions followed between the Ministry of National Security, Ministry of Foreign Affairs, through our embassy in Washington, and the local ambassador, the representative of the United States here. And we had a delay in order to examine how we could best prepare to accept that number of individuals. It was delayed on more than one occasion during the time that we have been talking. But the issue, in fact, was the question of Jamaicans coming back to return to Jamaica, and we have to look at how that can be done in a phased manner. The question of the inmates is a challenging one, and the U.S. government are insisting on, in fact, sending home citizens. But we have had, I said, productive discussion, both with the local embassy and with our representative, the Department of Homeland Security and State Department through the embassy in Washington, and had the delays. But we are preparing that as necessary, or when necessary, we'll be able to accept them in the conditions laid down by the Ministry of Health.
Thank you, Minister. So just to be clear, we have these agreements to take back our citizens who have been deported from overseas. We have a very good relationship with the United States, and we were able to have discussions with our partners, with our counterparts, and the initial proposed dates were rescheduled to dates that were more favorable to our state and stage of readiness and preparation. And we are making preparations to have a controlled re-entry of Jamaicans. We have spent the last 2 weeks refining those protocols. And since we are on that subject, I have been following very closely the situation with the 43 Jamaicans, somehow I heard 43 Jamaicans, who unfortunately, and it is quite unfortunate, that they were not accepted back into the country. But the circumstances need to be clear. That, number one, the request was made when the ship was offshore, 12 miles offshore Jamaica. I believe they were refueling at the time, and they made a request through the appropriate channels. And I must say, from my review of what has happened, that the Ministry of Health and Port Health acted according to the orders that were approved by the government of Jamaica. They informed the ship's captain that our borders were closed and that any decision to accept the Jamaicans on board would have to go through a process. The order defined that process. It would have had to come to the Minister of National Security, and then it would have had to be discussed and ratified at Cabinet. When that decision, when that request came to us, in other words, from the point of the request to the Port Health and the Ministry of Health, which happened, I believe it was on Thursday of the week, it came to our attention, and it was Thursday quite late in the day, midday or after, and it came to our attention. We were having a meeting of a subcommittee of Cabinet, and immediately as it was brought to my attention, on Friday, we were having a meeting on Friday, the following day, immediately as it was brought to my attention, having reached the attention of the Minister of National Security, we said, yes, we would have to take them because it is the logical thing to do. They were close by. But by the time the Minister of National Security could have conveyed the approval, the ship had already left our waters on their way. So I know a lot of people want to make much of it. But the truth is that once the protocols are in place, we expect that the persons who are obliged to follow the protocols, they must follow the protocols. And it is just quite an unfortunate situation that the ship left before the conveyance of the approval. In general, I wish to say about this matter that the government of Jamaica always acts in the best interest of the people of Jamaica. We will put in place protocols that are transparent, protocols that everyone can have confidence in. There's no favoritism, no special treatment, and if there has to be any special treatment, it has to be thoroughly deliberated by the Cabinet and made on grounds that can be defended. So I believe we acted appropriately. We sympathize with those who are on board the ship who would want to come back home, as we sympathize with all Jamaicans who are overseas yearning to come back home. But we have to do it in a way that does not imperil those that are here.
Yes? Vanessa? I think you have to unmute your microphone on the
Can you hear
computer.
me?
We're hearing you well. Go ahead, please.
Good afternoon, or is it good evening? It's evening. Good evening, JIS. I am Vanessa Silvera. 2 questions. Just for clarity, regarding the 7-day restriction placed on St. Catherine, is the list of exempt persons and professions the same as previously published? And what sanctions, if any, will be brought against BPO entities and other companies who clearly do not follow the social distancing protocols and policies?
Very good questions. The exemptions list will largely be the same, but we will publish them tomorrow. We hope to take them to Parliament and then publish them thereafter. But they remain largely the same. In fact, we have made very little adjustments to it. And whatever adjustments are made, we will try to publicize them even before we publish them in the Gazette tomorrow. As it relates to sanctions and penalties, I don't want to focus on the specific case in point, which is the BPO at which the outbreak is associated. The point of fact that every Jamaican should appreciate is that the government of Jamaica has acted in a judicious way and in a way that reinforces the point that if you break the law and we have evidence, we will prosecute you. If you break the law, we will investigate to find the evidence to prosecute you. That is how we have conducted operations under the Disaster Risk Management Act. The Act allows for penalties up to $1 million, and I believe, what is it, AG? 12 months in prison. And we are going to pursue all cases, or both. So we will pursue all cases because, as I said before, you know, the Disaster Risk Management Act is designed like any law on the reasonable man. We are expecting that persons will act in a way to protect themselves and others and their property and resources. But if they don't, then we have to reinforce by enforcement.
Thank you, Prime Minister. There are so many on social media, and of course, we still have reporters on Zoom. Let me just quickly, though, because it's a lot in terms of the questions being asked on social media. If I work in Kingston and live in St. Catherine, will I be exempt? And also, will larger businesses located in St. Catherine still be open? I'm thinking of True Juice, Wisinco, GK Distribution, Hypro, etc.
All right, so let me be clear. If you live in St. Catherine and you work anywhere else in Jamaica, you must stay at home during the 7 days. If you are a part of the essential services and you are not ill, that is, you don't have flu-like symptoms or a respiratory illness with symptoms, then you should, with your ID, venture onto the public thoroughfare, present your ID at checkpoints, and go about your lawful business. You can return home to Portmore, present your relevant ID. You will be checked at both times, temperature checked, and if by virtue of that your temperature is within the accepted limits, you will be allowed to proceed back to your home, stopping nowhere else. Go back home. I hope that is absolutely clear. This is a lockdown. Many Jamaicans have been calling me saying, Prime Minister, when are you going to lock down? Lock it down. I don't think they understood what a lockdown means. We have been applying the measures gradually, as the cases justify. Our assessment is that with 32 new cases having been coming from an average of about 3 or 4, it is justified. If we don't act, you're going for St. Catherine. If we don't act, you are likely to see, by virtue of people just moving around. Because how did these 33 cases come about? It came about because someone who had the virus, probably asymptomatic, but who knows, maybe symptomatic and just didn't care, moved around, maybe in casual circumstances. Hi, how are you? Go and look for grandma. Go and check a friend. Go and look for a girlfriend here and a girlfriend there. And we have 32 cases now, so far, and possibly others to come from one site. So we have to stop movements now for 7 days initially. That gives us an opportunity now to get a better sense of who is ill, who is displaying symptoms, and if you are at home and you have the symptoms, you can call the Ministry of Health website, telephone number. It's 888-1-LOVE, or go on the website jamcovid19.moh.gov.jm and report, and we will be able to interface with you and provide you with the medical assistance that you need. That is the way in which we contain and control the spread of the disease. Outside of that, if you are not ill and you are fine, play your part. Don't go about and expose yourself unnecessarily. Because you don't know who it is at large now, so you don't know. So you want to stop. The virus can only move when people are moving. And that's why we have to take these very stringent measures.
Concerning the larger businesses, sir?
Well, it doesn't really matter. And we have a list of exemptions. So that list of exempted businesses will probably change a bit, but let me say what businesses we expect to be open. Supermarkets and corner shops, pharmacies, and gas stations. And they can only be open during the period that is allowed, which is from 8 a.m. to 5 p.m. Tomorrow, when we publish the Gazette, we will, if it becomes necessary to add other businesses to it, then that will be publicized. But as of now, people should only be moving for the essentials of life. Health centers and doctors' offices would be added to this for the essentials of life.
Thank you, sir. Let's move to Mr. Damian Mitchell from the Gleaner Company. Damian?
Yes, thank you. Prime Minister, I hear you saying that you learned that the Jamaicans were here on April 3, albeit they came on April 2. But will the government categorically say it did not know that the Morella was heading to Jamaica before April 2? That's question one. Question two, did the health authorities receive the requested temperature data of the passengers, and what did it do with it? And also question three, what is the government's policy for the treatment and handling of bodies of deceased COVID patients?
All right, let's deal with the bodies of deceased COVID patients first. So CMO, you might want to take that.
The Ministry of Health and Wellness has developed protocols for the handling of the bodies of patients who would have suffered from COVID. And these protocols have been disseminated and have also been discussed with the funeral directors. If it is that you have a specific question about the handling of the bodies, then I would take that question.
Thank you. The Marilla did arrive in the waters of Jamaica on the 2nd for refueling. That is not information that comes to the minister or the political director at any time. The normal refueling of a ship passing by the corporate area, that is 12 miles off coast, I think, on the California banks to be exact. While they were there, the captain made a request to the harbor master and the Port Health Authority that some Jamaicans would like to disembark. Of course, they were informed, as is correct to so, and as published in the orders by the relevant professionals, that the harbor was closed. That's not only in Jamaica, globally. However, while the captain got information, he decided to withdraw his request. In the meantime, the Ministry of Health and Procurement, the professionals involved, was sent them information up and to make us aware, and there were some calls informally, that was by individuals from the ship to various personalities in Jamaica. So we got the information on Friday, and that was during the cabinet meeting, and I accepted that since they're this near, we would consider getting them onshore. But of course, protocols had to be maintained. You're looking at a situation where we had all imported cases, a disease that would create the kind of problem we're doing today, and therefore the Ministry of Health to speak with us to look at how we could manage such an inflow of Jamaicans coming home while that discussion was being held. And on the instruction of the Prime Minister that we would, in fact, seek to accommodate them, we understood that the request was withdrawn. And they're on their way out of Jamaican waters.
So just to be clear, the knowledge that I had of this situation was on the Friday. I just checked my diary, and the Friday was the 3rd. Noted, I did say that the ship came in the day before, which was the 2nd, though I didn't call the actual date. But the ship came in the Thursday, I believe it was, the Thursday afternoon, and made the request at that time. The information got to me while we were in our coordinating meeting. Luckily, I had the Minister of National Security, the Minister of Foreign Affairs, the Minister of Local Government, and I believe the Minister of Tourism was with me, and the Minister of Finance. And when it came to our attention, we all said, well, you know, this is a situation that we should consider. And I said, yes, go ahead. By the time the minister went out to make the call, to give the approval, he came back and said, Prime Minister, they have left. So I just want that to be clear, because in a time of crisis, there are persons who are trying to find all kinds of issues to hang on to. And we need to be kept in check. But I am also going to be very frank and very plain and straightforward that we are not going to give any quarter for anyone to hang on to misinform and distract. I think all Jamaicans know we must remain focused.
Thank you, Prime Minister. There are several follow-up questions to the ones on social media. I just have 2 more from the media as well as we close. It's now 3 minutes to 8 o'clock. Sir, they're asking on social media to just clarify if the opening hours for businesses, is it daily or on the specified days, Wednesday and Saturday?
Only on the specified days. So we have given 2 specified days, and that is Wednesday and Saturday.
Thank you, sir. Let's go now to Michael Sharp of JNN. Michael? All right, we're not getting to Michael. Let's then try Owen Brown from Roots FM. Oh, okay, we have Michael. Go ahead, but Michael, you need to unmute your microphone.
I did.
Okay, we're hearing you.
I couldn't. Yes, one gets a sense of a collective disappointment with the numbers that have come today. But Mr. Prime Minister, to what extent does this put you back to looking back at your model with these new numbers? And is there a change in the back rooms as it relates to the way forward?
You know, Michael, I would not be truthful if I said I was not disappointed, because the entire cabinet, the entire government, I think all Jamaicans of good conscience would have been praying that we keep our numbers on a linear path. And I think that the truth is we have been doing very well to remain on this linear path. We're probably still on a linear path if we manage this control mechanism in terms of the lockdown. We could probably still remain on a linear path, but just on a higher path. So yes, we are very disappointed. We didn't want this to happen. But the truth is that in our modeling, We expected it. And in all our press conferences, we have been saying that there will be a spike, there will be an upturn. But when it happens, you will always be disappointed. But we have planned for it. We have always said that once this happens, this will be the reaction. So nobody should be surprised. I just don't think that many Jamaicans understood what it meant when we say that we would react with a lockdown if the numbers justify. And so I think Jamaicans are coming to understand it, and will understand it a little bit more as we go through the crisis. My own perspective, Michael, is that the numbers will continue to rise because if you look at the infection rate of the disease, it's some people say it's about 2.1 CMO, 2.5. So you're going to see it start to trend. We have to put in place these measures to control it, to keep it below the capacity of the health system. And I don't want Jamaicans to feel that it's the entire health system that we will be able to turn to deal with COVID-19. You still have dengue. You still have people dealing with the road accidents, people still being shot and injured. You still have people with the NCDs. So it's, the health system doesn't have a great deal of capacity, and it certainly doesn't have a lot of surge capacity. And that is why we have been going through such great lengths to inform the public and appeal to the public, because we know the danger that the country could be in if there is an uncontrolled spike.
Thank you, sir. Let's go to our last two questions on Zoom. Edmund Campbell from The Gleaner, and then after Edmund, we'll have Owen Brown from Roots FM. Edmund, go ahead, please.
Good evening. Am I coming through?
Yes, we are hearing you, Edmund. Okay,
very well. One question for the Minister of Finance and the other question for you, Mr. Prime Minister. Regarding let me start with the Minister of Finance. The personal protective equipment. I'm being told that the government has granted waiver on some of these pieces of equipment, but there are some that are not, in which waivers are granted. Could you clarify that for me, please, if waivers are granted on all pieces of personal protective equipment for the health sector? And so, Prime Minister, regarding the lockdown, what about the suppliers of goods to the supermarkets and the corner shops as well as the pharmacies? Will they also be exempted?
So I believe that the Ministry of Health would have been successful in their procurement of personal protective gear, a lot of it arriving over the weekend. The government's intervention program has been focused on transfer of resources to individuals who are vulnerable and individuals who are likely to be affected directly by the COVID pandemic. Our intervention has also focused on providing resources directly to the Ministry of Health. So, the intervention has been on the expenditure side of the ledger, which is a very transparent way of understanding the effort that the government is making and the resource envelope that is being utilized to combat this COVID pandemic.
Sorry, Edmund, do you mind reminding me of your question?
Edmund? I think he's...
the suppliers of goods, Prime Minister.
You see, nobody remember the question.
Supplier of goods.
Edmund, yes. In fact, I'm glad you raised that, because in the same way that we have provided particular days on which citizens will be able to restock, there will be a set day that businesses that are allowed to be open will be able to restock. So what we're planning to do, we haven't decided on whether or not it will be a Thursday or a Friday. We want to have some more consultation with the distributive trade as to which day is best to restock the shops, the corner shops and pharmacies and supermarkets in the area. So by the time the Gazette is published, that specific day for restocking will be done. We have to control all movement because it will be an overwhelming task if we were to allow everybody to move for the police to be able to control. And remember what the objective is. The objective is to have 7 days of limited movement to slow the spread of the disease.
Thank you, Prime Minister. A final question will come from Owen as we get Owen up. Another question from social media concerning public transportation. Will the JUTC be able to operate for those who are part of the essential services who may need to travel from St. Catherine to Kingston and other places?
Those provisions will be in place, the JUTC in particular, as it was in place during the regular curfew, but that will be a limited service.
Thank you, sir. And we now go to Owen Brown from Roots with the final question. Owen?
Good evening. Thank you so much. Are you hearing me?
We are. Go ahead, please.
Okay, great. Thank you so much. So have just one concern. A worker of Alarica, the call center, they contacted us saying that she's basically worried because she wants to get tested, but she's not sure what to do. She said she went to the Greater Portmore Health Center, our clinic, but they said that she should go to Alarica. She went to Alarica yesterday. She never got tested. They're saying that they're not sure. She went ahead and she called the 888 One Love number, but she was told that they're not sure basically what to do or what to say to her. She's now home. She's not worried. She's having some level of cold and she doesn't know what to do. There may be other persons or other workers of the call center who may be going through the same thing. They're not sure, calling their supervisor, the supervisor not knowing what to do. How is it basically that these other persons who may not be tested, what's the procedure going forward for that? All right, and for this particular case, what kind of assistance can be done basically for this person?
Okay, so first of all, that sounds quite unusual because we have contacted, working with the database that is available from the employer, the call center. We have contacted quite a number of the staff, the workers, and indeed we have tested over 257 or 58, with others being spoken to as we speak. So the individual in question, if they're having that level of difficulty, the 888 One Love number is manned by a call center which has quite a number of persons. So if they're not getting through once, try again. If not, they could contact their local health department or health center. If I get a number for them, if you have a number, please feel free to pass it on, maybe through the OPM here, and I will arrange for contact to be made directly. So there are many ways to get in touch, and we would be happy to arrange any special accommodation for the individual because we are in touch with all others. So if you pass on a name and a contact, we'll be happy to follow up with the person.
Thank you, Minister. Prime Minister?
On that regard, the Minister, we had a discussion today, and the intention is to test everyone in the call center. So I'm certain that if they haven't gotten to her now, they will get to her in short order. That's the intention. They have to test everyone in the call center. And indeed, they will be widening their circle of testing to ensure that as far as possible, they capture everyone.
I'm sorry, sir. So there are a lot of workers on social media just wanting, again, just a clarification in terms of those who need to move out of the parish for work who are not symptomatic at all. If you could go over those procedures.
All right,
so let
me, because I know people are having difficulty with the concept of a lockdown. So the concept of the lockdown is that everyone is required to stay at home, stay in your premises. As a general rule, and specifically applied to Portmore, if you are ill with flu-like symptoms, or you have a respiratory illness with symptoms, meaning you're coughing, you're sneezing persistently, you have a fever, stay at home, meaning stay indoors and isolate yourself from your household because you don't want members of your household to get ill. Do not go outside. Now, the intention of the lockdown is quite different from the what we call the work from home orders. That's different. We're saying everybody now must be home, except if you are part of the essential services. And people who are in the essential services, they know themselves. I'll ask the Attorney General to come and read out who are the people in the essential services. If you are in the essential service, you may take the chance and leave your house. Present your ID to the policemen who may stop you on the road, or if you reach a checkpoint. You will be temperature checked, but you must have your ID with you and you should be wearing a mask. If you pass the temperature check and your ID is satisfactory, you will be allowed to leave and proceed towards your essential function. You can return to your home, passing through a checkpoint, getting a temperature check, showing your ID, and ensuring that you have on your mask, and you proceed to your home. The only people that should be moving outside of the parish are persons who are considered to be essential services, personnel. Movement inside the parish will only be allowed for the essentials of life, and even so, it will be in a specified time frame according to certain rules. The first rule being that if you are 65 years and older, if you are pregnant, or if you are part of the disabled community, you may, if it is necessary, proceed onto a public thoroughfare, into a public place, and into a supermarket, a corner shop, a gas station, a pharmacy, a doctor's office, a clinic, a health center, a hospital. Receive that essential service that you need and proceed to your home. And that is between the hours of 8 a.m. to 10 p.m. for those who are 65 years and older, pregnant, or part of or a member of the disabled community. If your name, your surname starts with A through to M, then from 10 a.m. to 1:30 p.m., you can go and get the essentials of life. That is on Wednesday. Let me just make sure I give the right information. That is tomorrow, Wednesday, the 15th, or Saturday, which would be the 18th. Saturday would be the 18th, right. And if your name is from N to Z, from 1:30 to 5 p.m., you can pursue the essentials of life. That is tomorrow, Wednesday, the 15th, or Saturday, the 18th. When you decide to go out on the road, if it is necessary, on those 2 days that you are permitted, you must wear your mask and you must have a picture ID, which is government issued from a recognized institution. I think we have covered almost everything. Well, the AG will classify.
Right. For the members of the public, I really just want to take the time to explain a little bit what it is that is to be expected, and for the workers from the call center, because I'm getting the impression from the questions and some of the questions that I have been receiving myself that there may not be clarity as to what is to be expected. Now, every single member, employee of the call center is going to be interviewed by the health department. We have started that already. Now, up to last night, 258 persons were interviewed. Another 51 were interviewed today, so over 300 persons have been interviewed so far. For persons that are symptomatic, we are interviewing their household members as well. So the health departments will visit the homes and they will conduct the interviews for the homes as well. Now, all the persons who would have been in the call center, there's a possibility of an exposure. And so therefore, over the next 7 days, you are to remain at home. In fact, you have gotten a quarantine order that have said that you are to remain at home for the next 14 days. Now, you may be developing symptoms at this time, and the health department will contact you. You have seen that we have sent out the notices to you through your human resources department, and we are now contacting you individually. So we have done several of the home interviews as well, and there are several homes that have been given quarantine orders as well. Now, the rest of the members of the public who have not been directly affected, meaning that they're not an employee and they're not a family member. They're not in the home. They are also at risk, because essentially what we have is that we have 700 and odd persons that have been exposed, that have been around the parishes of St. Catherine and Kingston and St. Andrew mostly for the last couple of days. Now, we do not know the level of exposure, and that is why you need to stay at home, because you need to minimize further exposure. And during the time that you stay at home, you need to be monitoring yourselves. And if it is that you develop problems, then you need to call the health department for us to do the necessary intervention. So the staying at home is to reduce your risk of any further exposure. Because right now, within St. Catherine, what we do know is that there are several persons who have been exposed. You don't know those persons. So therefore, when you go out to the supermarket or when you go out to the corner shop, you have to be careful, because you may be coming in close contacts, and that is why we're asking persons stay at home. And that is why the employees have been given a quarantine order to stay at home. I think it's very important for persons to understand these responsibilities that you have, because at this time, it is very important for us to slow the transmission of the virus. And what it is that we do not want to happen is for there to be any outbreak within the communities that these persons are coming from. Our measures right now are slowing the transmission and preventing any kind of community outbreak. This is where every single member of the communities inside of St. Catherine know, and as we get further information, we will announce with regards to the other parishes. But for now, we know several communities within St. Catherine are affected. And therefore, these measures are to protect you. It is to protect your family members. It is to protect the vulnerable persons within your homes. So everybody needs to stay at home, obey the quarantine orders, and then if you do develop problems, you call the health department and we will get in touch with you.
Thank you, Prime Minister. Ladies and gentlemen, just to remind you that the persons exempted will remain exempted outside of the parish of St. Catherine. In relation to the parish of St. Catherine, we will have to do some refinement. But just to let you know that among the persons who will be allowed to move in and out, if you are well and upon your carrying a photo ID and wearing a mask and being temperature checked in and out, members of the security force, persons employed in a service concerning the provision of health, water, electricity, public works, sanitation, firefighting, civil aviation, or telecommunications, including the spectrum, immigration officers and custom officers, correctional services, and those providing services to corrections. In respect of the transportation of agricultural produce or livestock or persons employed in the poultry industry, there will be a little modification in that regard insofar as the parish of St. Catherine is concerned. Persons employed in the sugarcane industry, because we recognize it is the crop time. We also have persons employed in services connected with oil refining and with the loading, distribution, or transportation of petroleum fuel, liquefied natural gas, or any renewable energy source. Persons employed in services connected with the loading and uploading of ships and with the storage and delivery of goods at or from docks, wharves, warehouses operated in connection with the docks and wharves. And that is because our ports remain open for goods in either direction. Persons employed to the JUTC or media continue to enjoy their exemption. Persons employed in businesses providing private security, persons employed to the toll authority under the Toll Roads Act, persons employed in courier services, persons engaged in transportation of manufactured products, and persons employed to factories as defined in the Factories Act. And Indicom remains exempted, yes. The Indicom Commissioner had asked. But just to say that in relation to St. Catherine is on lockdown, and lockdown means that you stay at home. Movement is limited to your getting the essentials of life within the specified hours. And if you work in any of the other essential services outside of the parish and you're not ill, then your movement will be allowed in and out, subject to the other conditions of your presenting your photo ID, you're wearing a mask, and you're being temperature checked, and of course, you're being well. So, ladies and gentlemen, we have the general provisions for the island. Persons must stay at home, generally. In relation to St. Catherine, the exempted category will be modified. As a general rule, you're required to stay inside. You will be allowed out to get the necessities of life, to get your food and get your supplies. 2 days are designated within the 7-day period. Tomorrow at the start of the lockdown, tomorrow Wednesday, and then again on Saturday. So you must make the decision to go out and replenish your stock. On the other days, you will have to stay in. So for those who are asking, if I live in St. Catherine and I work outside, will I be allowed in and out? And the general answer is no, but there is an exception. You are accepted if you work in any of the essential categories, and you're exempted only for the purpose of going to work. And only if you are not ill, because if you are ill, even if you work in an essential service, you must stay home. And when you are going out, you will have to walk with a photo ID, and you will also have to wear the mask once you are in the public space. And remember, you will be temperature checked. Right? So exemptions again, they will be published. They will be published, and publication in the Gazette operates as notice at large to the world. And in addition, Prime Minister will also go through the categories in the Parliament tomorrow. But when we publish in the Gazette, it amounts to notice at large to the entire world. And we have been circulating, right. Parliament remains exempted, and the government has to go on because decisions have to be taken in your interest. We will ensure that you get the information in a timely way. There are some things that will have to be refined and are being refined even as we speak with you. But the aim is to keep you safe, and it relies on your cooperation. I have been getting all of the queries, and everybody wants to be exempted. It cannot happen in the parish of St. Catherine during a lockdown. And Prime Minister is asking for your cooperation, ladies and gentlemen.
Thank you, AG. As we close, because we are heading to the curfew, and though we have exemptions, we still respect the curfew. I am told that there is quite a panic in the population in Portmore, as we expected. This is part of, we expected, and in St. Catherine. Supermarkets are crowded. I want to take this opportunity to appeal to all Jamaicans. Panic is the pan in pandemic. We must not make it any worse by taking action that is not thoughtful. We thought about what we're going to do in a lockdown very carefully. We spent more than 3 weeks planning, which is why we gave days for restocking. Note that the day for restocking is tomorrow. There is no need to break the curfew today, which will be strictly enforced. If supermarkets and other such entities remain open, they will be in violation of the curfew and could incur charges. They must close at 9 sharp. So I'm asking the people of St. Catherine, there is absolutely no need for panic. Your government has thought out these measures carefully, and we are putting them through a very thoughtful rendition process to ensure that there is no need for chaos. My advice, and I implore you, go home tonight, rest, find peace, discover yourself and your family during this period. We will get through this as a stronger nation. Thank you and good night.